speaking with Professor David Nutt. Today's report shows that the overall prevalence of mental disorders has not really increased, but there is a continuing troublesome indication that care has not changed. Why might that be, Doctor?
Well, I think there's a three-stage problem. We have the problem that people who are mentally ill don't understand they're ill, and that's true whether they have anxiety disorders or psychosis, and even depression is often seen as a failing rather than illness. And then they go to the GP, who often says things like, well, if my job is as stressful as yours, of course I'd be depressed, or of course you're anxious, because that's the way you live. So they don't get treatment then. And if they do eventually get through to psychiatrists, many psychiatrists also make that mistake or don't know the appropriate treatments for these disorders.
What would you like to see? There's been several recommendations given.
Well, what we need to do, we need to get public educated about these disorders so that they can present appropriately to GPs, not only with the symptoms, but also with recommendations as to how they might be treated. So we need to empower patients to get more engaged in helping themselves and getting doctors to help them.
Would you like to see more go over to specialists, however, for this care?
I think we have just too many. You saw the data, there's 160 million people with mental health problems in Europe. They can't all be treated with specialists. No, I think we can train, GPs who are interested can be trained to be very good at dealing with a wide range of psychiatric disorders, but they have to be interested, committed, they have to believe in them.
This is Patrice Wendling for Global Medical News Network.